right, we are back again with a clinical conversation, this time with an outsider, Dr. Ken Cooper, who is a lead instructor at Master Dry Needling. We are very excited to have him. We have Ashley Langford, Director of Clinical Excellence at CORA in the CORA Institute for Clinical Excellence, and I'm Adam with the CORA marketing team. And today we are talking about dry needling, and we have the expert with us today. This is going to be great, and this conversation is going to be a little bit more geared for patients who are wondering what dry needling is. We're going to try to answer some of those questions. We might get a little bit detailed, but bear with us. In the next, I'd say 5 to 10 minutes, you're going to learn a lot about whether or not dry needling is for you. So let's kick it off. Can you just tell us what the heck dry needling is, Ken?
It's interesting you asked that. I was teaching in Raleigh-Durham, and I got a chance to tour Duke, and I was talking to the head football coach, and he asked me the very same thing. And he said, he put me on the spot, and he said, I'm going to give you one sentence to explain dry needling. And I said, Coach, come on, man. I have like a 1-hour PowerPoint on that. And he said, nope, one sentence. So I said, I was kind of proud of myself. Nobody ever put me on the spot for one sentence. So I said, everything the body needs to do to recover from an injury, dry needling speeds that up. So if you have an issue in your body, whatever the body is already trying to do to heal that problem or get the problem corrected, dry needling assists by speeding that process up. So whether it needs more circulation or less spasm, less pain, all the things you need to get over a condition, dry needling speeds that process up.
Talk to me about the conditions that you can apply dry needling toward.
The research is a little bit lagging behind. However, I can tell you that this is my 33rd year to needle. And so I have helped almost every diagnosis that I have ever treated in the realm of neuromusculoskeletal disorders. So that is the pinched nerves, that's the joint pain, that's the back pain, that's the neck pain, that's the headache, that's the tendonitis, bursitis, all the itises that we treat in our field. Dry needling has been very powerful. When I came across it as a clinician, I was a physical therapist in a large hospital in Lubbock, Texas, and I was already treating all of these things. And one of our clinicians went actually to an acupuncture seminar, which is interesting. And then they came back and gave an in-service, and we started learning all the different acupuncture points. Of course, in that time, physical therapists couldn't puncture the skin. So we used electric probes and just put stimulation into the acupuncture points. And that kind of spurred me on to get the ability to put needles through the skin. And so I went back to chiropractic college after I've been a physical therapist for several years, and got the license to do that. And then I came across Janet Travell's book. She was JFK's doctor. And so you patients out there probably have heard of that JFK had a bad back. And he would often, the story goes, he would walk into her office, Dr. Travell, on crutches, and walk out carrying his crutches after she worked on his trigger points. So I got her book and I started putting acupuncture needles into the trigger points in various muscle groups and had fantastic results.
Okay, so two things. 33 years, you said?
Yes.
Gosh, you're like
I'm older than dirt.
It's like the avocado. I feel like nobody knew what avocados were until like the last 4 years, and now they're everywhere. Same thing with dry needling. I guess they've been around for 30 years, and now it's everywhere. Okay, so let's dive into dry needling versus acupuncture. If you were putting dry needling needles, if there is a difference, and you can help me understand that too, into acupuncture sites, what is the difference?
And I might take that same question too, Ken, and ask, like, from your experience when you were playing around with the acupuncture, the points, is there anything that comes to mind that stood out to you as a result where it was like, wow, this works, or that was a really cool experience?
Yeah, those are great questions. So, Adam, let me answer yours first. So, the needles that Dr. Travell was using were actually syringe needles. She is a physician. She was injecting lidocaine and other medicines into the trigger points in the muscle. So when you do that kind of treatment and you want to do a research project, you have to have a control group, and you have to test the reaction or the outcomes of the control group versus the experimental group, right? So what she would do is she would insert the needle into someone, for example, with pain in their shoulder, but she wouldn't depress the syringe to put the medicine in. She would just stick the needle in. In the experimental group, she would put the needle in and put the medicine in. And then she would look at the two groups to see who had the better outcome. And that's how most research projects are set up. The patient didn't know which they were getting. They just told her if they were better or not. And so the physical therapists that were working with Dr. Travell noticed that the people that had the needle put in their muscle, but the medicine was not injected, got almost just as much relief as the group that did have the needles with the medicine injected. So that's what kind of spurred me on to think, if I had a license to be able to put the needle into the trigger point, I wouldn't need the medicine, because her control groups that didn't get the medicine got better as well. So, Ashley, you said it, pretty point on. I hate to say playing around, but that's what I was doing, is seeing if I could replicate her work. And she has a 2-volume textbook on her methods, body-wide, over 400 techniques. And so that's what I started doing as soon as I got out of chiropractic college. And then I also got certified in acupuncture, right? And so in answer to your question, I have tremendous respect for acupuncturists. And as I got certified in acupuncture as a chiropractor, we were taught either by chiropractic acupuncturists or Asian trained acupuncturists. So what I learned, and what gives me so much respect for them, is acupuncture itself is very complicated. And it takes a long time to learn all the Eastern philosophies that go along with traditional Chinese acupuncture. And so I found myself having better outcomes when I treated my patients with needling trigger points than I did with trying to master the whole art and science of acupuncture. So that's kind of what happened to me. Along about that time, this was in 1992, along about that time, I started treating the Dallas Cowboys. And they came in having standard complaints. My shoulder hurts after the game. And the very first one that came in, I was able to, he had a trigger point right in his shoulder blade. I was able to put the acupuncture needle in directly into it, and he got immediate relief. And that kind of started a whole cascade of players coming in with whatever injuries they had in the game. So I found myself dry needling more and more as time went by. The differences in the needles, by the way, is that acupuncture needles are not hollow. So that lowers the chance of infection greatly, because as you put it through the skin, a hollow syringe can actually pick up a little plug of skin on its way under the skin, and it can carry bacteria or other microbes with it. And acupuncture needles are not hollow. And also they're thinner, so it's more comfortable for the patient. So that's why we choose to dry needle with acupuncture needles versus syringe needles.
In my early experiences with it, I know a lot of our local endurance athletes were, once one had it done, then 2, 3, 4,
Everybody
the
wants
entire team, the entire community, the entire race. Yeah, it's something that didn't take
exactly.
long. Here's a question probably that a patient might ask, I would say. What about insurance coverage? Is this something that insurance typically covers, sometimes covers, doesn't cover?
I would say it's getting up to sometimes.
Okay.
So when I started needling back in the early 90s, there was not an insurance code for it at all. There were insurance codes for trigger point injections, but this was not. It was like a dry injection, which is how it came about to get its name. Dr. Travell didn't know what to call the groups that she was putting the needle in, but not injecting medicine into it. So she called them dry injections, right? So the physical therapist with her started calling it dry needling because as PTs, they weren't injecting, but they were putting a needle in. So they called it dry needling. In 2020, the insurance coding group and the American Medical Association coding group finally assigned it a code for dry needling. It now has codes. But it's still considered investigational and experimental in most insurance companies. That's changing a little bit year by year. 2020 was a big COVID year, so the insurance companies were pretty much overwhelmed just with that. So uh, we've seen it covered. The VA often covers it if the doctor writes out the order. Some of the car insurance agencies or policies are covering if there's a written order for it. Some work comp carriers are starting to cover it. And so it's slowly transitioning into being a covered procedure.
Can you talk to me a little bit more about what the heck is happening? You're putting the needle in my arm or wherever. What is happening? What's happening to me when this happens? Like, am I
So
crying? Does it hurt?
that's a good question. So the needle is very small. And so it's possible, there are different techniques, of course, in dry needling. And it is possible to do a dry needle treatment that's almost totally pain-free, even though you're sticking the tiny needle in. There are other techniques where we actually try to find the middle of a sore spot, but we always base the intensity of that treatment based on the patient's tolerance of the treatment. So if a patient has a very tender spot and there's a lot of pain reaction with it, I'll change techniques to get the same results without pain or with very minor discomfort. I tell patients, it's like a mosquito bite. They don't hurt that bad, but you sure want to slap it. And so sometimes it feels like a mosquito bite. It kind of changes according to the patient's tolerance. But in answer to your question, a lot of good things happen when you put a needle in. The part of the nervous system that feels that is very communicative with sends a signal to the spinal cord and to the brain, and the brain sends signals back down the spinal cord into the tissues. So you have a group of biochemical reactions that happen right at the point of the needle inside the tissues, and that starts a chain reaction inside the tissues that lead to the good things I was talking about before, as far as pain reduction and inflammation reduction and spasm reduction and increased circulation and things that promote healing. So there's a group of reactions that happen in the tissues, and then there's a group of reactions that are controlled by the nerve signals traveling up and down the spinal column. So a lot of really powerful things happen as soon as the needle is placed accurately.
Mhm.
And then is there a recovery period? Can I have this done daily, weekly, monthly?
That's a great question. There's no real rule, but a lot of what I was trained by Eastern European physicians coming up the ranks of needling, and that's a long story I'll leave for later. But they taught a lot about the body is always trying to heal itself. So, for example, if you scratch your arm, it's going to heal on its own. You really don't have to do anything. And it's going to go through this process to right the ship and put everything back just like it was. So part of the beauty of dry needling is that when I stick a tiny needle into your tissues, it is actually a micro trauma. So the body treats it as a trauma. It has to heal that. And what we've seen is as it heals that tiny traumatic stick of the needle, it also heals whatever else is going on in the body. And so that it takes, literally, we've studied it, it takes about 72 hours to heal the little stick from the needle. And during that time, the body is also healing in the other areas that it needs to. So I typically like to treat twice a week because of that. There's certainly nothing wrong with treating more often than that.
Adam, this is a kind of a little bit off topic, but similar. I mean, I'm an insulin dependent diabetic, so I have needles put in me almost, I won't say hourly, but several times a day. And,
Sure.
I can still drink a pitcher of water and it doesn't leak out of me. So,
Right. That's a good point. And so the part of the practice, part of what we do in the seminars is to decide the depth and the angle and the placement of the needles for the maximum effect. And so the needles that would go in that you're using with your diabetes is it's still a micro trauma, but it's not directed to a tissue that's in trouble, right? And so we direct it into tissues that are struggling from an injury or from stress or from whatever else is going on. So it does make a difference where we put the needle in, what depth and what angle we put it in.
so
Any other information that a patient, any other questions that you've had in your experiences? Patients with questions like what are some of the most common questions that you hear if we haven't covered them already?
Oh, yeah. Well, you mentioned one earlier. People say, the first one is, how is this different from acupuncture? And so the answer is very simple. Acupuncturists heal the body by balancing meridians. And so we're not trying to balance meridians at all. We're using this micro trauma that I was talking about to speed up the healing process. So it's totally different in philosophy from acupuncture. The only thing we really share in common is the needle we use. We kind of borrowed their needles because they're small and they're not hollow. And so it's not acupuncture in any shape, way, or form. But we get similar results in a lot of cases than acupuncturists do. So that's probably the most common one, is this acupuncture? No, it's not acupuncture at all. It's actually investigating with the tip of a needle the state of the tissues under the skin so that we can discern if they need to be stimulated with the acupuncture needle that we're using, or we're not doing acupuncture. The second one is what you said earlier, does it hurt? So I hope I covered that just a little bit. And then people say, how will I feel after? And so it's a pretty simple answer, but some people get a little confused. So some people feel great immediately. Some people are tired immediately. That may last 1 to 3 days. And that's actually my favorite response, because it's telling their body to relax. And so they get tired. And we do our best healing at night when we're asleep. And the part of the nervous system that controls that is the same part of the nervous system that we activate with needling. So the fatigue that patients, I hope they feel, is always a healing thing. So the more tired they get, actually the better response I expect. So I explain that to them. You may be tired. Secondary, you may ache after this, depending on your response. So part of my job as a clinician is to judge how your body will respond to needling. Then I can know which technique to most comfortably utilize with it. And then the third one you mentioned also is, how often do I get treated? The answer is 2 or 3 times a week. And then the golden question, the $1 million question is, how many times is this going to take? Right. And of course, nobody knows the answer to that, but it takes several visits. I usually, say anywhere from 6 to 12. We really don't know. Let's do a few and see how you proceed or how you respond. And then I kind of can figure out what kind of responder they are. So when I'm treating the Dallas Cowboys, the ones that feel better immediately, treat them right before the game. The people that get tired immediately, I don't want to treat them right before the game. So if they're one of those responders, I'm going to treat those players the day before the game, or maybe 2 days before the game, or even 3 days before the game, depending on what kind of responders they are to the needling. And so all patients are like that, and we try to take that into account when we treat them.
Well, I have one more question, then we can wrap this up. Is it similar to kind of the PT philosophy that it's no one thing that's going to solve the problem? It's this approach. It's the treatment plan, which includes exercise and other modalities and manual therapy and all of these things. Is dry needling, should it be used in isolation, or is it similar to the PT treatment plan where, it's a more, I don't know, holistic, or you got more involved,
Sure.
you got more homework to do?
Yeah. And the best answer, of course, is that it's not a standalone treatment. It's part of a comprehensive treatment. One of the things that I found out about 12, 14 years ago now, I was in a wreck. And so as a clinician, I needed to get back to work because I'm self-employed, but I was also in a cast in a sling, right? So a lot of the things that I would do on a daily basis, I really couldn't perform. And so I would substitute dry needling for other techniques I've been using, and I was amazed at how powerful it was. So I always tell people this: not everybody will respond. It can't take care of every problem that you have. It's going to be a comprehensive thing, but let's utilize it. And I like to utilize it at the end of a treatment because of the relaxation it brings. And I like to have the patient stay kind of relaxed and even get tired that night. So I tend to needle patients at the end of a treatment session with the other modalities that I use.
Ashley, any other questions you want to throw out there before we wrap this session up?
No, I think it's been great just to kind of listen to the, the background and thoughts, and some of the stuff you're saying mirrors what I've said in the past with patients. So I feel good about myself already. So no, I appreciate it.
A mini course for Ashley. All right, this was great. We're going to wrap this session up. We are going to do another session that will be a little bit more clinical focused. So thank you, Ken, for being here. Thank you, Ashley, for your contributions, and we'll talk again soon. Thanks, guys.